Hello everyone, welcome to AMP with John. I want to first let you all know that as I make these videos, I myself am learning anatomy and physiology for my pre-nursing requirements. So if you notice any errors on my part, please do not hesitate to say something in the comment section. I will try to monitor those as much as possible, and in the end, my hope is to help those who are going through this class by sharing what I've learned myself. So here I have a torso model. Now this is a decently priced model that you can get off of Amazon, and I'll be sure to list the link down below for anyone who might want one for their studies or just as a figurine of some sorts. So when you first learn about AMP, you're going to learn about directional references. So firstly, you'll have your anterior view, then you will have your lateral view, and then your posterior view. Now, as you go further in your AMP course, you will notice that some terms will be interchangeably used with another one. For instance, ventral can be used in place of anterior, or posterior can be used in place of dorsal. When talking about the nervous system, you can say dorsal root ganglion or posterior root ganglion. In anatomy and physiology, you will see that a lot of words used are derived from either Greek or Latin. So let's get into other directional references. First, you will have your superior and inferior. So the superior and inferior are kind of how it sounds. Above is superior and below is inferior. So for example, you could say that your head is superior to your knee. Now you can't really see the knee on this model, so I do apologize. Next is your proximal and distal. So your proximal refers to the closest point of attachment, whereas the distal refers to the furthest away from attachment point. You also have your medial and your lateral. So with the medial, it is referring to the structures closest to our midline, whereas lateral is referring to the structures farther away from our midline. So for instance, when standing at anatomical position, which is currently what our model is at the moment, you can think of TSA screening when you are going through the millimeter machines. Your thumb would be most lateral, and your pinky would be most medial, as your pinky is closer to the midline of your body or the center of your body, and your thumb is farthest away. An important thing I want to note is when you're looking at the body or the model at anatomical position, you want to remember that your right is your left, and your left is your right. Now let's talk about anatomical planes. You have a sagittal plane, a coronal plane, a transverse plane, and an oblique plane. So your sagittal plane, that divides the body from left and right. However, it's important to note that there are multiple planes within this. You will have a mid-sagittal plane and a parasagittal plane. So a mid-sagittal plane is the cut in the center, or we could say cut through the midline of the body. One way you can remember this would be a pizza cutter. When they slice a pizza, the first thing they do is slice the middle. Sometimes it's really even, sometimes it's uneven. So if it was an even cut, a perfect cut in the middle, we could call that a mid-sagittal plane. Or on this model, you can see that they kind of showed the division from superficial to deep. But this was right down kind of in the center, so we could call that a mid-sagittal plane. Your parasagittal plane would be an uneven cut. So if the pizza person cuts the pizza unevenly, that would be called a parasagittal plane. Or if, let's say, rather than this model showing superficial from deep being in the middle, if they were to do it, let's say, on more your left side, and they did it through your eye and your orbicularis oculi muscle and straight down, that would be a parasagittal plane because it is then an uneven cut. Next is going to be your transverse plane. The transverse plane is plain and simple. It divides the body from top to bottom. One way you can remember this is if you ever watch Star Wars Phantom Menace, the scene where Kenobi cuts Maul in half. That is how you can maybe remember transverse plane. Or you can also think of this. This is your diaphragm muscle. Your diaphragm is what separates the thoracic cavity, which is more superior, from your abdominal pelvic cavity, which is more inferior. And then next you have your coronal plane. So the coronal plane divides the body from front to back, and it goes pretty much like this, straight line down. And then lastly, we have the oblique plane. An oblique plane is neither perpendicular or parallel, it's more of a diagonal cut. And that will be all for directional references. Now you do also have caudal and cranial, however, depending on your professor, you may not use that until later on. Thank you for watching.